All right, hello and welcome. Today we are diving into something pretty amazing, the intersection of technology and medicine. Specifically, how artificial intelligence is becoming this indispensable co-pilot for radiologists, completely changing how we see inside the human body.
So, to really get why AI is such a game changer here, you first have to understand the sheer scale of the challenge. Modern radiology isn't just about a few black and white x-rays anymore. It's a total tidal wave of data. Every single day, radiologists are hit with this massive, growing flood of super complex images from CTs, MRIs, and PET scans.
And that leads to the million-dollar question, right? We have more data than ever before, but there's a global shortage of the experts who can actually read it all. So with demand for diagnoses just skyrocketing, how can one person possibly keep up with all that without, burning out or missing something?
So here's our game plan for this explainer. We're going to start with that data overload problem. Then introduce AI as this digital co-pilot. We'll take a quick tour through the body to see its impact, look at how it creates smarter care, do a quick reality check on the challenges, and finally, meet the augmented radiologist of the future.
Okay, first up, let's really dig into the scale of this challenge, because it's what set the stage for AI's big entrance.
We're basically looking at a perfect storm of pressures. You've got more images, and they're way more complex. You have more patients who need scans, and you have fewer radiologists to read them. This kind of environment just cranks up the risk for human error and fatigue, which makes the need for a tool that can boost both speed and accuracy more critical than ever.
And that brings us right to the solution. And I want to be clear, we're not talking about a replacement for people. We're talking about a seriously powerful new partner in the reading room.
So what do we even mean by AI in this context? Well, at its core, it's about building computer systems that can think a bit like a human. They can sift through enormous data sets, way more than any person could, to find patterns, make connections, and help with those really critical decisions.
AI in medicine isn't some brand new thing that just popped up. The actual term was coined way back in 1956, and by the 80s, we were already using early versions of it in mammography. The big difference today? The incredible power of deep learning. It has taken this whole concept to a completely different level.
All right, this is the really cool part. Let's take a quick tour of the human body and see exactly where these algorithms are already making a life-saving difference.
First stop, the brain. One of the most complex places we could possibly look. In neuroradiology, every single second counts. AI algorithms can now scan through head images in a flash to flag really critical, life-threatening stuff, like a bleed or a stroke, and alert the doctors immediately. It's a huge deal in a busy ER.
And just to give you an idea of the precision we're talking about, get this. One study found an algorithm could tell the difference between low-grade and high-grade brain tumors with 93.2% accuracy, just from looking at MRI data. That level of detail is absolutely crucial for figuring out the right treatment plan right away.
Okay, next up, let's talk about breast imaging, because here, AI is doing so much more than just spotting a potential tumor. These tools can see these incredibly subtle patterns in tissue that are pretty much invisible to the human eye. They can help measure breast density, which is a major risk factor, and even help predict how aggressive a tumor might become.
And the performance? It's really impressive. In one huge screening program, we're talking over 22,000 mammograms, an AI tool hit nearly 90% accuracy in detecting breast cancer. Just think about how that could boost early detection and help find cancers we might otherwise miss.
So yeah, AI is making diagnoses better, for sure. But its impact is so much broader than that. It's really about making the entire patient journey better, from the moment you schedule a scan to the day you start treatment.
This tech is making the whole system smarter. It can make scans go faster. It can build a crystal clear image from a low-dose scan, which means less radiation for you. It can even look at the hospital's waiting list and say, hey, this case looks urgent, let's move it to the front of the line. It all adds up to care that's safer, faster, and much more personal.
Okay, but for this to become our everyday reality, we have to be honest about the hurdles. Plugging AI into our healthcare system isn't as easy as, just installing some new software.
The promise of AI is this seamless, perfect system. The reality is, it's messy. Getting new AI tools to talk to old hospital systems can be a total nightmare. There are massive questions around patient data security. And then there's this big one, the black box problem. If an AI tells you something is wrong but can't explain why it thinks that, well, it's pretty hard for a doctor to just trust it.
And all of this brings us to the future. A future that isn't about replacing doctors, but about empowering them. This is the new era of the augmented radiologist.
I think this quote just nails it. An AI is brilliant at finding patterns in pixels. It's a master at that. But what it completely lacks is clinical judgment, context, and empathy. You know, the human stuff a doctor brings. AI is an amazing tool, but it's not a replacement.
And the power of this teamwork is just undeniable. Check out this study on prostate cancer detection. The AI, on its own, did pretty well. The radiologist alone, even better. But when you combine the radiologist with their AI copilot, boom, the highest accuracy of all. That is the synergy we're aiming for. Human expertise supercharged by machine precision.
So what's next? The future is this incredible field called radiomics. This is where AI goes into an image and pulls out thousands of data points that are totally invisible to us. Imagine being able to predict a tumor's genetic makeup or how it might respond to a certain drug, all from the pixels of a regular old scan. It's mind-blowing stuff.
And that kind of leaves us with this final big thought. As these incredible tools keep getting better and better at uncovering the hidden patterns inside our own bodies, that dream of truly personalized medicine gets closer every single day. The question really isn't if this will change healthcare anymore, it's about how profoundly it's going to reshape the future of health for every single one of us.